Welcome to CoI'Q, a first of its kind video program about health innovators, early adopters, and influencers, and their stories about riding the roller coaster of healthcare innovation. I'm your host, Dr. Roxie, founder of Legacy DNA Marketing Group, and it's time to raise our CoI'Q. Welcome back, CoI'Q listeners. On today's show, we have Michael Dermer with us, the pioneer of healthcare rewards. He was the founder of IncentOne, which he sold to Welltalk in 2013. And then more recently, he launched The Lonely Entrepreneur, an online learning community for business owners. Welcome to the show, Michael.
Thank you so much for having me.
Awesome. So I think, just to kind of level set with our listeners who maybe don't know who you are, let's start off by just telling us a little bit about your background and what you do.
Sure, I'd be happy to. I started my career as a corporate lawyer in New York City. Worked for a large New York law firm doing M&A, but I really wanted to start a business. I didn't know anything about healthcare, and I just literally stumbled upon my business. Somebody showed me a stat that said, for every 10 pregnant women that don't follow their prenatal care, it costs the healthcare system $1 million.
Mm-hmm.
We're like, whoa, like, why wouldn't we just reward these women or bribe these women to do it? And that was it. That was it in the end. Left my prestigious law job after 3 years and started what got to be known as the first company in the US to reward people for being healthy. And very, very new concept at the time. And through some very lean early years, bootstrapping it, and then eventually venture capital. Built the company up to about a $60 million company by 2008. And so we had kind of made it, and then almost watched our company get destroyed overnight by the financial crisis. Our clients were the largest companies in America, and as they struggled with the crisis, so did we. And then spent the next couple of years kind of battling, scrapping, and clawing, and started to build back up. And on the other end of the financial crisis, there was all this interest in healthcare. And we got approached by a bunch of investment bankers and got bought, and was sold to Welltalk in 2013. So it worked out great, but it was an incredibly wild journey over the course of about a decade.
It's so interesting. I mean, I think our listeners are just going to love hearing your story. Anytime I have a guest on the show who has an exit strategy that actually came to fruition, it makes for a real good story for our listeners. So you talked about this wild ride. So, you kind of touched on it a little bit, but what was it like for you, especially in the early days of riding this wild ride of roller coaster of healthcare innovation?
We really believe that we're onto something, because if you looked at all the trends in the industry, there was tons of investments in trying to get people to manage their diabetes and and the universal theme was that nobody could get anybody to do it. And so the idea of using healthcare rewards made complete sense. But what you realize pretty quickly in healthcare is that just because something makes sense doesn't mean that people buy it and all that fun stuff. And so early on, we had to marry the clarity of the vision, which we really understood, with how do you actually win business? And how do you actually influence a market that actually moves slow and is clunky and has a lot of hands in the pot? But it was amazing. I mean, it was basically me and one other person, and then slowly, incrementally building over time, and all the stuff, raising money, all the craziness that goes along the way, and then selling into an incredibly complicated market with not just a new product, but frankly, like a new industry. So it took an incredible amount of creativity to be able to do that. And, it's like you said before, it's easier now to look back and go, yeah, we sold the company and we were brilliant. But at the time, if you knew the number of doors we got slammed in our face, day I used to tell my private equity investors, the day before we sold the company, I was a moron, and the next day I was the smartest guy in the world. So that's just the way it works.
Right. Absolutely. So, you hit on this. What was the year that you started IncentOne?
Really, 2001.
Yeah. So, I mean, talk about early, it's really common today, but in 2001, it was unheard of. I mean, you were creating a new category.
Unheard of. And in fact, beyond even unheard of, but offensive. Like, it was offensive to the healthcare industry that they would have to reward or pay a pregnant mom to follow her own prenatal care, or to give a diabetic an incentive, right, to go get an eye exam. So we weren't just fighting the fact that it was new. The whole healthcare industry was fighting against it. You know, they did not want to open the door to have to use their own dollars to reward people. And we're like, listen, we would say, with all due respect, you know, you've been doing the same thing for 50 years and controlling, you know, one out of every $6 in America, and it's not working.
Right.
And every other industry out there uses rewards to try to drive behavior. So it was an amazingly interesting journey to try to basically shift the perspective of a very slow moving industry.
Mm-hmm. So I work with a lot of people, whether it's official or unofficial, that have different types of innovations that they're bringing to market. So sometimes it's just an incremental innovation, which is, valuable in its own right. And then other times it's like what you did, where it's a real radical innovation. And I think that there's a lot of differences between those two. There's a difference in risk, difference in reward, difference in strategies. Is that something that you can kind of look back and go, yeah, I knew that those were different and I knew how to do those, like I knew what was going to work for a radical innovation? Or is it something that you just really kind of learned the hard way over time?
Well, of course I knew what was going to work. No, of course not. It's funny, in our book, we call it knowing what inning you're in. You know, I'm an old baseball guy. So it's really hard to do, right? Because as the entrepreneur and someone who's had the vision for it, it's very clear to you what exists today, which is that everybody's going to use rewards. But you really mistime that, right? Because when you think about that and you say, oh, it's just a matter of time before you do that, all the decisions you make, right? How robust you make your product, when you go out for outside capital, and how much and how aggressively you go after it, especially to influence a market like healthcare. So those were decisions that we probably overstepped ourselves by probably 2 or 3 years. And I think we would have been more patient, although it's certainly not my DNA to be patient, but we would have been more patient and more deliberate about how we spent money and how we raised money, because you have to marry up your vision, your passion for it, and your belief in it with the industry that you're selling to and how much you're going to be able to influence it. So those were decisions that if I had those over again, I probably would have shifted by a good amount of time.
Yeah, absolutely. Yeah. I mean, I think that you're so right. This product, we talk a lot about product market fit, in solution problem fit, and the vision that the entrepreneur or innovator may have may be slightly different than what the target market is really looking for and how they perceive the problem that they have.
And, I think in healthcare in particular, but this probably exists in other industries as well. Let's say you have the perfect product market fit. You still have a lot of hands in the pot that have an incentive for the market not to change.
Yep.
Right? Especially in healthcare. So, what we were finding was that health plans felt really vulnerable that they weren't delivering this solution. And so they were very wary about dipping their toe in the water, right? So there's all these people that think about it today. It should be really easy for us to go online and have all our medical records in one place, right?
Right.
And we don't. It's not that the technology doesn't exist. It does. It's just the constituents in the healthcare industry don't want it to happen.
Yep.
So that's the
sad
challenge.
but true.
Sad but true. And unfortunately, it's hard enough to get product market fit. But even if you get that, you have to realize how to actually influence the market and create burning platforms and issues for them. Like, for example, you could go to health plan and say, this makes a lot of sense. It'll save you money on your pregnant women and your diabetics. And that's one thing. Or you can go into Pittsburgh and you can say to UPMC and Highmark, we're going to do this with one of the two of you, but not both. And that doesn't really have anything to do with product market fit, right? It has just that to do with how do you influence the market, and you just learn those techniques kind of over the course of time.
That's brilliant. I mean, just absolutely brilliant. And so, one of the stats that I talk about often is this 95% of innovations that are brought to market fail to reach any adequate level of profitability or customer adoption. And that's in any industry, and then you kind of add the complexities of healthcare that you just talked about. And so the question that I had for you, one of them is, how did you beat the odds? And you just gave us one of those strategies where, it's super creative. And it seems like, you've got to get creative today.
Yeah. So what really helped me was that I wasn't from healthcare,
Mm-hmm.
right? So when people would say to you, this is the way it normally works. You sell to a health plan and they do a pilot and it's a 3-year sales cycle. And I was like, well, why would you do that?
Right.
Why? So I was naive enough, let's say, to say, I'm not going to do that. And so I asked the question, and this has to become a core capability of innovators is, how do I influence the market to move?
Mm-hmm.
What are the factors that are going to make the market move? And at the time, the things that made health plan moves were their big employers, right?
Yep.
The big employers that they insured would make them move. So I started influencing them and saying, do you think health plan X, your health plan, should be doing this? And they said, absolutely, we think they should be doing this. And so we started to influence them, and that put a great amount of influence on the health plan. So I think the capability of innovators has to be, how do we create burning platforms, burning issues, competitive risk, liability risk, whatever it is, to be actually get the market to move. And that's a skill that we don't talk about that often. We say, yeah, if we have the cure to cancer, then it should be out there tomorrow.
Right. Right.
It doesn't happen.
Yeah. Yeah, absolutely. So, did you ever doubt yourself? And then how did you overcome that in your journey?
Up until the financial crisis, honestly, no.
Uh-huh.
I really felt that, if you save, for every 10 pregnant women, if you save the healthcare system $900,000, you've got a business there, right? So I never doubted that. The problem was, when the financial crisis hit, we were a pretty sizable company. And all of our customers were the biggest, my 3 biggest customers at the time, my 3 biggest employer customers were General Motors, Countrywide Financial, and Washington Mutual. And I don't know if your listeners know, but 2 of the 3 of those don't exist today.
Right.
And General Motors is on the front page of the Wall Street Journal every day about needing a bailout from the government.
Right.
The problem for us, and you talk about doubt, is the fact that I didn't control those macro issues, and nobody gave a crap about a 500-person company. So that was very, very hard, because normally you can plot a path. It wasn't that you'd walk across the street and decide whether to go left or right. You'd walk across the street and you know if the street was going to be there. So that was the challenge.
Big difference, right? Big difference.
Yeah, huge. None of the normal things that worked about financing and all that type of thing. Remember, customers are going bankrupt, customers not paying their bills, not bankrupt with us, but just in their own existence.
Yeah.
So that was just literally about, there's a famous Winston Churchill quote about, what was happening in London in World War II. And he says, you're going through hell, you just keep going. And you just literally had to put your head down and focus on the task at hand. And I'd be lying to you if I told you there was certainty that we'd get out of it, because it wasn't even so much about the value of our business. It was about what was going to happen on the planet.
Right. Of course.
At the time. And listen,
the country, if not the whole world.
all of it with unravelings all the time. And frankly, nobody cared about healthcare at that point. So that was, you just had to put your head down, and there was a ton of doubt, but, as many of you, I'm sure your listeners know, your job as the leader is to, have the right mix of ego and humility, right? To have the ego to do bold things, and yet the humility to understand how you have to learn and grow and push. And don't get me wrong, it's a lot for people to take on, but doubt's one of those things. Listen, I played college baseball, the best baseball players making out 7 out of 10 times. Right.
Right. Yeah.
you get used to it. So it was an amazing journey.
So it sounds like it was really important for you to really understand what you could control, and then how you were going to, wrap strategic planning and paths around that, and then understand what you couldn't control, and then figure out how to survive through it.
Yeah. And that's one of the things, of course, the famous quotes about, working on things you can control. The one challenge on our end was the fact that we didn't know where revenue was going to come from. We had customers.
You still have to make payroll.
Yeah, you have to make payroll, right? So you have customers that you've spent years building up, long-term relationships with, and now they're worrying about whether they're going to be able to pay their own bills. So the hardest part about it was that you couldn't control what your revenue path was. I remember a client calling us up and saying, no, we're staying with the program, and calling back a week later and said, we can't do it, right?
Mm-hmm.
So it was, you certainly could control cost cutting. We tried to be super creative. Like we didn't let a lot of people go. We chopped up jobs into multiple jobs.
Mm-hmm.
We just did whatever we could because our company had been built on the backs of these people.
Sure.
But yeah, I mean, you really do have to, when you're an entrepreneur and innovator, you really do have to say, I may take on the biggest challenges that I have to innovate, but it's got to be things I can control.
Mm-hmm.
The only thing I would say is there's always a way.
Yeah.
There is always a way, and that's what entrepreneurs a lot of time bring to the table, is that you basically say, I don't care how it was done yesterday.
Yep.
Right. And we look back at those businesses and go, of course, but at the time, it was hardly commonplace to do those types of things. So
yeah.
It's an ongoing journey.
Mm-hmm. Absolutely. Even today.
Yep, of course.
So kind of bouncing back to something that we touched on a little bit earlier, I want to talk more about your positioning strategy and messaging strategy around having a radical innovation, because I think that that's one of the pitfalls in the commercialization process is if a category doesn't exist, how do you position it and how do you message it to where people understand what you have to offer when they don't have anything to compare it to?
Yep. So there's two big things, right? Mm-hmm. One is you've got to create a theme that people lock onto. Nobody pays attention to the details. Right? Even somebody could send us $1 million in our mailbox these days and we wouldn't even open it, right? So you have to create a theme. And number two is you have to find a playground where nobody else is playing. It's not enough to say that I'm going to have a unique value proposition. You've got to basically create a completely new playground. So I'll give you an example. For us, the theme, right, was that if you have all these people that are providing healthcare solutions, for diabetes and heart disease and exercise, would you get your incentive platform from them, or you would want to have something that's kind of the center of the wheel?
Yep.
And we painted that theme for our customers, and it made sense to our customers, even though we didn't have the sales budgets or the marketing budget. It made sense. Well, yeah, if I have WebMD and I have Health Dialogue and I have this company for biometric screenings, why would I get an incentive program separately from all of those? Mm-hmm. And so what we would say is our theme would be, your listeners may not remember this because it's a while ago, we're the universal remote, right? Okay. We're the remote that works on all things. Yep. And so we could go into a sales meeting and draw a wheel with spokes around it and say, the difference is that if WebMD offers it to you, you're getting it from one spoke of the wheel, right? Versus the model of you get it from the hub.
Yep.
And so that theme made sense to them.
Mm-hmm.
And so they started to go to their existing vendors and say, is this the way you do it? And it was selling apples to oranges. So that, what I would say to everybody out there is you have to create a theme. They're not going to look at the details of your product. I mean, think about when you buy a car, you don't go open up the manual.
Right. Or under the hood.
Or under the hood. You get a feeling or a sense. And the second thing is finding a playground where nobody else is playing. For us, when we started our company, the average American was enrolled in 27 reward programs, right? Your hotel, your airline, right? All that stuff. All we did was be the first to apply it to healthcare.
Mm.
So we just created a playground where nobody else is playing. The most recent example of this is there was a Super Bowl ad by Budweiser in the last Super Bowl that basically it's a whole medieval times thing where they deliver corn syrup to the Budweiser castle. And Budweiser says, no, that's not for us. That's for Miller Lite or Coors Light. We don't use corn syrup. And they have now defined corn syrup as the criteria for which you should use to buy beer. Let me ask you, did you even know beer had corn syrup?
No.
Did you ever buy beer because it had corn syrup or didn't?
Right. No, it's not part of the decision-making process.
Right. They have now defined that as a criteria that they win. In fact, Coors and Miller Lite have sued Budweiser over that claim now, which, by the way, is exactly what Budweiser wants. So the point is that Yeah, the point is that they found a playground where they win, right? And so what I would encourage your listeners to do is, it's not enough to find just a unique value proposition or something. You have to define a place where you're the only one there. Could be a really small place.
Yep.
Right? Because then you define the rules, you define the pricing, you define the criteria for buying, right? And that's where innovations can really take hold.
So that's wonderful. I know that that's going to be just amazing wisdom for our listeners. Is that something that was part of your strategy early on, that you found this piece that you could play in, and then did you expand out of it? And is that how you got to the 60 million?
Yeah, so for us, that theme made sense. We knew that there were a lot of hands in the pot that were selling to our customers every day. There were health plans, there was employers, there were service providers that were going to be much more well-funded than a startup. Remember, for somebody like me to leave a big law job in the year 2001 was a relatively big deal. Now, if you don't do it, you're scorned, right? So,
right.
So it was different back then. There wasn't a startup ecosystem. If you were a small company in healthcare, everyone was going to say you're a small company. Why would I ever do business with a small company? So that theme gave us a criteria where we always won. So it didn't matter that we were selling against Aetna or selling against Health Dialogue or WebMD. It didn't make a difference, because we were selling apples to oranges. And remember, we were doing it without 1,000 salespeople on the street, without huge marketing budgets. But the ability to plant in our customer's head, we would say the following: whether you buy it from us or not, this is what you need. And so we were, to your point, we were basically selling something completely different. And we just said, listen, you decide which model is better, right? And we would say, even if you, let's say to a health plan, even if you built it yourself, this is what you should build.
Yeah.
And so we really started to have a different dialogue where it doesn't matter how much money somebody is spending on marketing. If you're talking about apples to oranges, you just put yourself in a much better position to be successful.
How did you get in front of those key decision makers? And you know, one of the things that I hear all the time, people ask me, Roxie, how do I rise above the noise? You know, there's an explosion of innovation, you know, thousands and thousands of companies. A lot of us are trying to sell our wares to the same people. You know, how do I get in front of those decision makers? You know, what was some of the strategies that you used around that?
So I'll tell you what I did do, and I tell you what I would do. So I literally used to sit down at 7 o'clock at night for an hour and leave voice messages for CEOs of the largest healthcare companies in the country. So I knew that they weren't going to pick up their phone at 2 PM. I wanted to be able to leave a message for the CEO of United Healthcare that said, what my second point is, it has to be something that is burning platform on the CEO's desk.
Yep.
Right? If they wake up every day thinking about it, right? If it's what makes them lose their job, right? Or get their butt kicked by Wall Street, I don't care who it is, they will call you back. So if I pick up the phone and I said, okay, UMPC and Highmark, I'm going to roll out a reward program that's going to drive behavior and cost savings in your people. I'm going to do it with UMPC, or I'm going to do it with Highmark. Call me back. I think, right? The argument is, if you had that and your competitor didn't have it, it would be competitively differentiating.
Yep.
Right?
Yep.
But it's got to be a CEO level issue, right? Yeah. It can't be about widgets. It can't be about product. It has to be out. What about if a health plan was going after the small business segment, right? And you said, you've got to be able to deliver rewards in the small business segment because you're going to lose 1, 2, 3, and it's 30% of your book of business, and this is the economic impact. Whatever it is, you've got to be able to craft a message that talks to the things that are in the CEO's bonus plan. Yeah. Right?
Absolutely.
Like, why does he or she get fired?
Right. Yep.
If you do that, you'll get a call back the next day, and they will go, I want you to talk to so-and-so. If you don't do that, if we said, we've got the next great red dress or the next blue widget,
let me tell you about all these features and functionality.
Right. Think about if you were the CEO of a large company, what phone call would you return?
Yep.
It would be only the ones that caused me competitive risk, revenue risk, reputational risk, right?
Mm-hmm.
And if you did, I'd be like, oh my God, I better talk to this guy or gal.
Yep.
So
Brilliant.
and we had a lot of, we probably had 6 or 7 out of 10 calls back.
Nice.
It was amazing.
That's fantastic. Yep. Okay. So what's the other half of that? What would you do differently today?
I just think that same approach had to, when you would get pushed to, let's say, product people, right? There's a lot of people in healthcare and product that work really, really hard, but are working with an infrastructure that's really hard to move.
Yep.
So you have to understand who is willing to be innovative, right? Who can be innovative. So in retrospect, you could have a go-to-market strategy that said, like we did, we're going to go after health plans first, and then later after employers. I would actually have picked companies that shown a predisposition for innovation and doing things differently. Because some health plans just, like, they're just not wired that way. If you go to a product manager, yeah. So it would have been much more productive, I think, to say, you know, this Blue Cross versus that Blue Cross. You know, some Blue Crosses were participating in venture capital funds, they were doing acquisitions and investments, and others weren't doing any of that. You know, there's a big difference between, you know, Cambia, right, and Blue Cross and blank, who remain nameless. But that was the other thing I would have differently. I would have tried to predispose people that were already showing an inclination for wanting to innovate.
Yeah, that's definitely one of the conversations that I have with clients, because I hear a lot of innovators where they don't really understand the diffusion curve. They don't understand that the innovators have that predisposition that you're talking about in early adopters versus the laggards. And so they end up getting really discouraged. They go out into the marketplace and they're beating the door down and doing a lot of arm twisting with the laggards. And they also come back and say, I'm too early, you know, or I have a solution for them to solve their problem and they just don't get it. And they realize that they're focusing on the wrong part of the market.
Yeah, totally. 100%.
Absolutely. Yeah. So let's talk about your business model a little bit back then. You know, did your business model look the same when you sold the company that it did from day one when you first, you know, launched?
It did. What was interesting was that the whole quote unquote reward industry that existed, you know, in banking and airline and all these loyalty programs, the lion's share of profitability came from the actual reward. You know, you're a pharmaceutical sales rep and you hit your numbers and you get a television, right? And there was a lot of margin in those televisions. Nobody cared about the technology. Nobody cared about the analytics. And frankly, nobody wanted to administer cash because you didn't make any margin on cash.
Right.
So we flipped the model on its head and we basically said, no, this is a software license business. We're going to license our software, not software, SaaS, right? We're going to have subscriptions that'll be paid for by health plans. We don't care what reward you use, right? We're going to integrate money off your insurance premium, money out of your HSA, gift cards, debit cards, but you're going to be paying for the administration platform and capabilities to be able to do that. So we were, you know, 70% license, about 10% transaction fees, a little bit of, you know, probably another 10% professional services, and another 10% we made a little spread on rewards. But because we said we're going to be kind of universal with respect to rewards, that very much was a different model than existed in the marketplace at that time.
Absolutely. So, you know, as we kind of start to wrap up here, a couple of other questions that I have for you is, you know, if you had to pick one, what do you think was the main decision that you made in that commercialization process that most influenced your success?
By far the data architecture of our technology.
Really?
Right? Yeah, because what people said is every incentive program is different, which is actually true. You're a woman, I'm a man, you're going to get rewarded for this, I get rewarded. And the one thing we said early on was, well, hold on a sec, that's true, but the elements are always the same, right? You have a behavior, right? They're going to get something for it. And so by far, the most influential decision we made was to take the time to build out the data architecture in a way that meant that we could support any design of incentive programs. And that was the biggest thing, because then think about it. If you said, I'm going to go after diabetes, and you built a whole product for diabetes, right? Or so you built a whole product that gave pregnant women $25 or gave pregnant women gift cards, or those would all be what existed before, which is very customized solutions without scalability. So that by far was probably the biggest thing we did in the process, is to understand how the data architecture of what we do is going to influence the market.
Yeah, it sounds like that would be either a big roadblock or a big runway for success.
100%, yeah.
Yeah. So why do you think some health innovators fail and why some succeed?
I think it's always the sales process, in my opinion. I shouldn't say always, it's predominantly the sales process, right? Because it's just really, really complicated to sell into healthcare. I think innovators spend too much time on product and not enough time on selling and positioning. And you hate to say that because you have to have great products, but at the end of the day, the ability to have a healthcare organization understand the economic impact you're going to have, or some other impact that you're going to have, is paramount. Right? And so, and this goes beyond just, kind of lean canvas or minimal viable product. I'm talking far beyond that, right?
Yeah.
I'm talking about when you wake up every day, right? And you say, what am I going to do? Right? If you're not spending time on some of the things we've talked about here with respect to selling and positioning and creating themes, you can create the best widget in the world. I remember it struck me back then, one of my developers, we had a pretty big technology team, said to me, I don't think this is true now, but then they'd be like, we hate Microsoft products. Like we hate the Microsoft technology stack. Yeah. And yet everybody uses them. You're like, wait a minute, how does that work? Well, marketing and positioning and distribution are incredibly important. And I think if you drew a pie chart, people probably spend 10% on it and 90% on the product, where that should be much more like a 50-50 mix.
Yeah, absolutely. I was talking to someone the other day and they were year 3 and they hadn't launched yet because they were still working on the product. I said, how in the heck do you even survive with no cash flow?
And oh, by the way, when you show up with the product, healthcare organizations are still going to say it's off.
Right. Absolutely.
So it's really more about the economic impact you have and how you fit into that economic impact.
Yeah. Or the other scenario I hear often is, can you help me launch this innovation into the market? Okay, well, what's your budget? And it's like peanuts. And I go, okay, well, how much did you invest in the product? $5 million. So what were you thinking when you invested $5 million in the product, but you want to go to market with 25,000?
Right. Listen, I would today, if somebody said to me, start a reward business in healthcare, I'd call American Express and I would say, let's just wrap this into your reward program. Right. So, and that has nothing to do with what technology exists. It just has to do with the fact so I'll tell you a quick story. When we were starting our company, I went to one of my high school friends. His uncle was Harvey Gallup, who was the CEO of American Express. Okay. We went to them and said, listen, we're going to build this reward program, but we really shouldn't. You already have American Express rewards. So why don't we form a joint venture? And we went really, really, really far down the road with them about forming a joint venture. And it ended up blowing up at the end because they were concerned about their brand and how it'd be perceived in healthcare. But we got really far.
Really?
Think about today, none of the reward programs would exist. You literally would get American Express rewards for all your healthcare behaviors, and they would own the world. They would own the $20 trillion.
What a missed opportunity. My goodness. So what do you have to say for those fellow entrepreneurs, healthcare innovators that are in the trenches right now, today, in different stages of the commercialization process?
Yeah. Number one is positioning. You've got to be able to come up with this positioning, the themes we're talking about, the playgrounds that nobody else is playing. That is your most important thing that you can do. All due respect, nobody cares about you creating the next X or the next Y. If you can't position yourself in a way that does two things. Number one, creates real impact. economic impact or liability or risk or competitive impact. And number two, does it in a way where you're going to stand out from, remember, Aetna, Cigna, United, like there's thousands of sales professionals out there on the street selling for really large organizations, right? Your number one challenge is how you cut through that.
Yep.
So to me, it's your positioning in this, finding your playground where nobody else is playing, which is the most critical thing that you can do.
Absolutely. So today, my last question for you. Today, you are running The Lonely Entrepreneur.
Yep.
So, just kind of communicate it through the lens of the Health Innovators of what you're doing there and what value they would receive.
Yeah, I mean, what we really want to try to do with The Lonely Entrepreneur is to try to empower people with the knowledge and skills they need. And we've mentioned a couple of them here. But today, where you go to find that is you go to a million different places. If you walked into a Starbucks and a WeWork and asked 100 people where they get the foundational information they need, you get 100 different answers. So what we really tried to do is to put that in our platform. We call it the Lonely Entrepreneur Learning Community. And it's designed to be kind of a one-stop shop for the knowledge and tools and resources that you need. And we wrap around it support in the form of a community where you get your questions answered and coaching. And so we're trying to say to people, for those of you that can't afford somebody like you or somebody like me to coach you one-on-one, which I know we both do.
Yeah.
Wouldn't it be great to be able to, for us, it's $500 a year, have access to all this knowledge and learning and also support system that hopefully can bring some of the ideas we've talked about here into one place that you can access efficiently. So that's what we're doing.
I think it's very valuable.
Great. Thank you very much. We're having fun trying to help everybody.
Absolutely. So how do folks get a hold of you if they've got questions maybe about how to, join the Lonely Entrepreneur or just, questions about their innovation process?
Yeah, happy to. So anybody who wants to reach out to me can reach me at michael.dermer@lonelyentrepreneur.com. And about the Lonely Entrepreneur, just go to lonelyentrepreneur.com. And also the book is available on Amazon called The Lonely Entrepreneur. And happy to talk through, I've been through it, you've been through it. It's an incredibly rewarding but difficult journey. And if I can answer a question or if you need more help, I'm happy to do anything I can do.
Wonderful. Thank you so much for your time today, Michael. I really appreciate it. And thanks for sharing your wisdom with our audience.
Thanks. It's a pleasure being with you.
Bye-bye.
Bye.
What's the difference between launching and commercializing a healthcare innovation? Many people will launch a new product. Few will commercialize it. To learn the difference between launch and commercialization and to watch past episodes of the show, head to our video show page at drroxie.com. Thanks so much for watching and listening to the show. You can subscribe to the latest episodes on your favorite podcast app, like Apple Podcasts and Spotify, or subscribe to the video episodes on our YouTube channel. No matter the platform, just search CoI'Q with Dr. Roxie. Until next time, let's raise our CoI'Q.